नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI Vidyapeeth Women's University, Jaipur. Today's topic is malabsorption syndrome. Definition and classification. The malabsorption syndrome (MAS) is characterized by impaired intestinal absorption of nutrients, especially of fat. Some other substances are proteins, carbohydrate, vitamins, and minerals. Malabsorption syndrome is subdivided into two broad groups. First is primary malabsorption syndrome and secondary malabsorption syndrome. Primary malabsorption syndrome, which is due to primary deficiency of the absorptive mucosal surface and of the associate enzymes. And secondary malabsorption syndrome is in which mucosal changes result secondary to other factors such as diseases, surgery, trauma, and due to drugs. Causes of primary malabsorption syndrome. First is celiac sprue, second is collagenous sprue, third is tropical sprue, fourth is Whipple's disease, fifth is disaccharidase deficiency, and sixth is allergic and eosinophilic gastroenteritis. Now, causes of secondary malabsorption syndrome. Secondary malabsorption syndrome can be have multiple causes. First is impaired digestion. In impaired digestion, first thing that can cause an impaired digestion is mucosal damage. That is example for conditions that causes mucosal damages are in tuberculosis, in Crohn's diseases, in certain type of lymphomas, in amyloidosis, in radiation injuries, and in systemic sclerosis. Second thing, second thing that can cause impaired digestion is hepatic and pancreatic enzymes insufficiency. Third, that resection of bowel also causes impaired digestion. Fourth is drugs, that is methotrexate, neomycin, phenididone, etc. can cause impaired digestion and leads to the secondary malabsorption syndrome. Now, first is impaired digestion, second is impaired absorption. And what can cause impaired absorption? First is short or stagnated bowel, blind loop syndrome from surgery or diseases resulting in abnormal proliferation of microbial flora. Second is acute infectious enteritis. And third is parasitose, that is Giardia or strongyloids and hookworms. They all can cause impaired absorption and leads to the secondary malabsorption syndrome. Third cause of impaired Third cause of secondary malabsorption syndrome is impaired transport. First is lymphatic obstruction, that is in lymphomas, tuberculosis or lymphangiectasis. All can cause impaired transport and leads to secondary malabsorption syndrome. Another example is abetalipoproteinemia, which can cause secondary malabsorption syndrome. Now, clinical features of malabsorption syndrome. First clinical feature, which is most common, is steatorrhea, which means pale, bulky, foul-smelling stool which floats on the water. Second is chronic diarrhea. Third clinical feature is abdominal distension. Fourth clinical feature is Bomborghini sounds in abdomen and excessive flatulence. Fifth clinical feature is anorexia. Sixth clinical feature is persistent weight loss. Seventh clinical feature is muscular wasting. Clinical feature is dehydration. Ninth clinical feature is hypotension. And tenth specific malnutrition and vitamin deficiency depending upon the causes. Investigation for malabsorption syndrome. First is laboratory tests. In that, we test for fat malabsorption, test for protein malabsorption, and test for carbohydrate malabsorption. Vitamin B12 malabsorption test is also done. Intestinal mucosal biopsy. Mucosal biopsy of small intestines is essential for making the diagnosis of malabsorption syndrome and also for evaluation of a patient on follow-ups. Some other important type of malabsorption syndromes. First is celiac sprue, also known as non-tropical sprue or gluten-sensitive enteropathy or idiopathic steatorrhea, or also commonly known as celiac disease. Second is Whipple's disease, also known as intestinal lipodystrophy. Third is collagenous sprue, and fourth is tropical sprue. Now we're going to learn about celiac sprue. This is the most important cause of primary malabsorption occurring in the temperate climates. The condition is characterized by significant loss of villi in the small intestine and therefore diminished absorptive surface area of intestine. The condition occurs in two forms. First is childhood form, which is seen in infants and children's and in commonly referred to as celiac disease. This is the most common form of the celiac sprue. Now, second is adult form, seen in adolescents and early adult life and used to be called idiopathic steatorrhea. In either cases, there is genetic abnormality resulting in sensitivity to gluten, a protein, and its derivatives, gliadin, present in diets such as grains of wheat, barley, and rye. Serum antibodies, immunoglobulin A, anti-gliadin, and antibody immunoglobulin A anti-endomycelia have been found, but it is not known whether these antibodies are primary or appear secondary to tissue damage. The symptoms are usually relieved on elimination of gluten from the diet. The role The role of heredity is further supported by the observation of familial incidence and HLA association of the disease. Exact pathogenesis of the condition is not clear. However, following hypotheses have been proposed in causing mucosal cell damage. First is hypersensitivity reaction as seen by gluten stimulated antibodies, and second is toxic effects of gluten toxic effect of gluten due to inherited enzyme deficiency in the mucosal cell. Now, collagenous sprue. This entity is regarded as the end result of celiac sprue, in which the villi are totally absent, total villus atrophy, and there are unique and diagnostic broad band of collagen under the basal lamina of surface epithelium. The condition is refractory to any treatment and the course is generally fatal. Some workers considered collagenous sprue as a variant of celiac sprue without classifying it separately. Now we are going to learn about tropical sprue. This disease, as the name suggests, occurs in individuals living in or visiting tropical areas such as Caribbean countries, South India, Sri Lanka, and Hong Kong. Pathogenesis of the condition is not clear, but there is evidence to support enterotoxin production by the some strain of E. coli which causes the intestinal injury. Severe cases are characterized by additional features such as macrocytic anemia, glossitis, and emaciation due to intestinal malabsorption of vitamin B12 and folate. Whipple's disease, intestinal lipodystrophy. This is an uncommon bacterial disease involving not only the intestines but also various other systems such as central nervous system, heart, blood vessels, skin, joints, lungs, liver, spleen, and kidneys. The disease is more common in males in 4th to 5th decades of life. Patient may present with features of malabsorption or may have atypical presentation in the form of migratory polyarthritis, neurological disturbances, and focal hyperpigmentation of the skin. This session is powered by Digital Version 2.0 Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in comment box. Thank you.